What does it mean when someone is missing a permanent tooth?
There are many situations where a patient just genetically does not have a tooth bud that forms, and so they have a retained baby tooth or primary tooth that does not have a permanent tooth to replace it. That can create a lot of problems, with space. There's a lot of things we do to maintain those positions with baby teeth. And we have a lot of adult patients that still have baby teeth that we're still using. It's important to keep those teeth healthy as a child. But it is a fairly common thing. We also have patients that have extra teeth. So there's situations where you have, an extra adult tooth, and sometimes that can affect the bite and the occlusion, and sometimes that leads into orthodontics in different ways. One of the most common things that are missing are sometimes the laterals, not the front teeth, but the teeth right next to the permanent teeth. And that becomes a big concern cosmetically as those kids become teenagers. It becomes a big aesthetic problem. And oftentimes we will replace those, with implants when they're adults. Dr. Thomas can probably talk a little more about that.
Yeah. So yeah, we try to hold the baby teeth in as long as we can. Ideally, you want to wait till the patient's a good candidate to get an implant. So when their jawbone stops growing, basically. So we try to get them into their 20s. And so if we can't do it, we can temporize it. And if we can get them to that point, then we can take the baby tooth out and replace it with a titanium implant, which is basically a root replacement that we can cement the tooth on when that heals up inside the bone. But it's really important for stability of the arch, so teeth aren't moving around or closing into that space, and function and aesthetics.
I get asked a lot of times, can't they just grow a new tooth or grow a new, from a stem cell or something? And I'm not aware of any studies yet that will predictably do that, but just as an interest note, we've seen work done, usually it's in Scandinavian countries, where a patient was missing their side teeth and the dentist transplanted a tooth from their back of their mouth to the front of the mouth. So it grew like a posterior tooth, like a bicuspid, right in the front, and then when the patient was old enough, they crowned it to look like, an anterior tooth. It was fascinating, and then they replaced the back tooth with an implant because it wasn't so obvious in the front. But it was really neat to see. So there's some people working on all kinds of alternatives for congenitively or missing